we're doing the talk on adjustment versus manipulation. Now for a lot of people, they just call this a semantic, but it's a huge difference in my profession because one is completely a physical phenomenon, and the other one, you're looking at more of a neurological, and you're looking at what is the cause of the problem. Is it a chemical? Is it a emotion? Or is it a physical issue? The reason why I talk about this and make it a big issue and a big disclaimer, a big difference, is because the word manipulation, it by definition is taking something beyond the normal, to manipulate, to change, to augment. So when you manipulate something, it's coming from a Newtonian view, which is the view of only physics, only physical. We're not looking at the body in an energetic form or in a form where it has any intelligence. We're looking at it in the form where it is something to manipulate or augment, just as you would with something like, say, a drug, where you manipulate the body to change it to what you want to have happen. A manipulation, by definition, is taking a joint, such as maybe a thoracic. The neck didn't like that one, right? So that got manipulated. So taking it to its end range and then some. So what will actually happen is you'll take that joint, and what we're going to draw here is this, is some bones and the ligaments around it. And say it's rotated to this side, you're actually going to take that joint to its end state and then a little bit more, and you're actually going to cause ligament laxity and damage. That's what a manipulation is. It actually takes a joint to its end range of motion and then moves it farther. By definition, that's what a manipulation is. So in this office, we do not manipulate, because my goal is not to take a joint to its end range. My goal is to change neurology and find out what the underlying cause is. So manipulation, by definition, can only help change the physical structure, so they're only looking at the bones. There is no other correlative factor that you're looking at. So if you're looking at a Newtonian view or a very physical view, you're looking at moving the bones. And people can do that. They can reef on things and change segmental structures. And what happens here is when a bone is rotated, the structure is adapted by ligamentous and muscular structure changing. If we look at it in this form, what we're doing with the manipulation is we're not looking to what the body wants to have done. We're looking to augment it to what we believe is right. So this is what would be called a educated intelligence versus an innate intelligence. And when we talk about that, innate is the body itself and its ability to heal and take care of itself. Whereas an educated is us deciding what normal is and then putting people there. Just like deciding your blood pressure has to be a certain rate. So if we decide your blood pressure is supposed to be 120/80 and we put you on a pacemaker and it keeps you there, and you walk outside and it's 100 degrees, you will pass out. Because your body cannot move enough energy, and you'll actually start getting heat stroke and having heat issues because you can't diffuse that energy quick enough, and you'll have a problem. So the inability to adapt is an educated thing. It's basically us determining what is correct, and then that's why people get sick, is us determining where they're supposed to be, where the body knows perfectly. So if we walk outside and it's really hot like today and it's 100 degrees, and we can't raise our heart rate, we can't cause our body to pump quicker, then we'll have a problem. Same thing if we walk outside and it's cold. We have to increase our metabolic rate by increasing our heart rate, shivering, different things like that. So the inability to adapt is actually the first sign or the cardinal sign of disease. So if you keep something at the constant state, that indicates it can adapt. That means it doesn't have what's called allostasis, and that means it's going to die. So you can look at this in hearts. If a heart stays at a constant rate, it means that person's going to die very soon. So we don't want a constant thing. We want an ability to adapt based on environmental factors. So, tornado.
Going to be a long walk down.
All right. So when we look at this, what we're looking at is the body's ability to heal. So I'm glad that power went out because we stopped talking about the stuff that isn't good anymore. Now we're going to start talking about the good stuff. And that's the innate ability for the body to heal. So the first one we were talking about is our body being done and having things change based on what we think is right as humans. And we all know that that isn't always right because we can look on television nowadays and see how many drugs right now are having recalls and problems and the body isn't healing correctly. Hundreds. Call this law firm because XYZ is happening. That's what we're looking at here. The next thing we're going to talk about is the innate ability for the body to heal. And this is where the adjustment comes in. So this is the chiropractic adjustment. Because the adjustment, I'm looking for what one or two or three factors is causing that problem. Is it an emotional? Is it a physical? Is it a chemical factor? Which factor is causing it? If we know that, then we can know how to help the body adapt, how to help the body change. Because when I look at the body and I see that a segment is rotated out of position, if we let it purely structurally, we say it's out of alignment, let's force it back into position. That's called manipulation. What if I look at the structure and say, why is it there? Why is the body doing this? Why is it making this happen? And we say, okay, is the body doing this because it's overstimulated on one side of the neurology more than the other, because it had a huge emotional stress? Or is it like this because it had a huge chemical stress, say a drug, and that stimulated it, and then as a byproduct the muscles got stronger on this side because maybe it's a right brain person and rotated out of position? What is it that I'm looking for? So the reason why I went over manipulation first is because it's very structurally oriented, whereas an adjustment is purely neurological based. I actually don't even have to move the bone to adjust somebody. The adjustment by itself is to adjust the neurology to put in a proper neurological flow so the body will heal itself. It just depends on how much impulse or energy you need. There are some techniques in chiropractic where you're touching the person literally just like that, and you're very lightly touching them. The art or the application is all dependent by the doctor and what they want to do. And I played a lot of sports, so I like to use my hands a lot, so I like using a little bit of force when I adjust people. But there are techniques I can use that are very light, and that can adjust them as well. So the adaptation or the changing of the body is the adjustment. It isn't the movement of the bone. The adjustment is the proper stimuli of the brain, allowing it to adapt. And that adaptation is the key. That's where we want to see the body go. So if we look at this, we say, okay, the body is rotated to this side. If I'm a Newtonian guy, I'm going to say, well, we got to reef it back and get it back there. That's a manipulation. If I'm looking at it through a more of a quantum view or quantum physical view or more of a neurological view, I'm going to say, why don't I get this body to stimulate this side? Why don't I put in an impulse? A slight impulse stimulates the brain, the muscles get stronger here, and it pulls itself back. Because the thing is, the only thing holding this segment out of alignment is the neurology. It is not a structural problem. The structural problem is a direct byproduct of the brain not working correctly and not firing correctly. So if you become overstressed, if you say, let's go into a cool one, visceral somatic reactions. If you cause your body to overstimulate, say the mid-thoracic region or dorsal region, because you drink a lot of alcohol, what will happen is that feedback loop, by stimulating the organ, the feedback loop will overstimulate one side of the brain and will actually cause the body to pull itself out of position. This is a good one. Yeah. So when it's actually pulling itself out of alignment, it's pulling itself out of alignment because of the overstimulation of the organ. So the body is actually getting subluxated by the chemical being ingested, and the chemical causes the afferent or nerve firing back to the brain to overstimulate, and the body will try to adapt, and that adaptation is it'll actually subluxate itself. So people don't actually understand that the subluxation itself is an adaptation to allow the body to evolve, to adapt. And if you want to look at this, and this is the best theory I've heard on this, is the subluxation will allow you to become polarized, and when you become polarized, you can think differently. So you become way off in 1 second, you get adjusted, it will change your thought process, and then you'll go back to another way of thinking. And we see this with our patients. They'll come in, and when they start, this is a common thing I see, they'll start and they'll be angry, or they'll be depressed, or they have anxiety, and then as we adjust them, their whole physiology changes, and their ability to think changes, and they think differently. But if we have to think of the body as an ability to heal itself, and it's doing this to help you think differently. So not think of this subluxation as a disease, but as an adaptation to allow you to evolve in the way you think, which is the hard place for a lot of people to come from, because they have been taught there's disease and there's health, and there's just black and white. But there's gray areas in between. And the evolution of how you get there is all determined by how you adapt to the environment. So subluxations by themselves are actually fluid. They do not always stay in one position. So in the morning, they can be different than in the afternoon. And that's because the neurology changes based on how you adapt emotionally, physically, and chemically. The brainstem will actually fluctuate in the skull and move up and down, depending on what part of the day you're in. So depending on how you've been injured and what time frame you're at determines how you should be adjusted. And that's why if I have somebody who always comes at, say, 6:30 at night, and I just can't get them better, I'll tell them they should come in the morning. Because it depends on where their trauma is indoctrinated or stuck in their neurology. If they hurt themselves in the morning and that is the key component for them, then we have to adjust them in the morning. If they hurt themselves when they're breathing in, then we have to adjust them when they're breathing in. Because it's about replicating the stress of the environment and then adjusting them and changing the neurology, changing the brain flow and how it communicates. So this is a different way of looking at it and understanding that everything your body does is it does on purpose. It does to heal you. It does to help you evolve, and it's not something bad. A lot of people get stuck on pain. They'll say, well, I have pain and the pain is bad, but they never actually look at what the pain's from or look at what the symptom's indicating. I actually learned some of this from the osteopath who took care of the Queen of England. He actually talked about there's evolutions of disease processes and dysfunctions people go through based on how they're removing things. And if they evolve correctly to get rid of their problems, they'll go through specific things if they're not balanced correctly. So when you look at the body, it's not about reefing bones in and out of position, because you don't have to do that. There's a couple techniques I practice. One is called toggle recoil, and the only segment that I'll adjust is the first one in the neck. Now, interestingly enough about this technique is that's where the vagus nerve comes through, and that nerve controls 80% of all the healing in the body. So some people I've referred to it as this up here is the mouth of God where the skull enters, and that's what the yogis call this. When you connect this and you put in a slight force, the body will actually adjust itself. And we've seen this. We've taken functional x-rays, so it's a motion x-ray, and we've seen a person adjust somebody, and they don't actually do it with their hands, they just use a light little tap. And that little tap, and the bone will actually oscillate if you don't move the person for 3 hours until it sets itself in the right position so that it'll heal itself. So the healing is not coming from me. It's coming from me applying the force, and your body realigns it. So when we apply it in the right position, the body will take the force that's stimulating the muscles and apply it and realign itself. This is what actually drastically changed the way I took care of people. It was because I was doing a completely structurally based thing, and I was trying to force things in, and it was working, but I didn't realize that it was working because I was doing neurological based care, not because I was having people do specific exercises. The exercise will ingrain the neurology so it'll work correctly, but the communication pathway is the key. And that's why I've been able to see people now that come in and they're way out of alignment, and like a scoliosis. And we adjust them and it will pull itself back into position as long as the neurology works correctly. So the drastic difference between an adjustment and a manipulation is that the adjustment has an underlying concept that the body is smart, and that we're applying a stimulus so the brain will reattach itself to where it needs to be, basically realign itself. Whereas the manipulation is the person telling somebody else that this is where you need to be and putting it in a position. And that's why there's two different outcomes. Because when you stimulate the brain, it will use the information very easily if it likes what you're doing. Because sometimes you might be stimulating the wrong place and then the body doesn't like it at all. Now, does that mean you have a symptom? No. Does it mean maybe you go home and you have a different emotional a day or a different thing like that? And you really have to get into the nitty-gritty of how do you adapt. Sometimes it's retracing when your body's removing stuff and we're breaking those cycles of emotion, chemical, and physical. And that retracing is actually breaking the cycle and allowing the body to get rid of those toxins that it's held, emotion, physically, or chemically. But the adjustment by itself is a stimuli. It is not a manipulation, because the key thing is that we're applying a sensory input so that the body will attach that input and move it to the state that it's needed in. It's not about reefing or moving bones. That's why when we see people and they start balancing out on x-rays, or their brain waves change on EEGs that I do here, that's me being told that I'm stimulating the body correctly. And you guys have noticed that in my practice now I've integrated, I call them goggles, it's brain tap. And what that is a technology that with the adjustment integrated with it, we can change the neurology and how it functions correctly. So we can teach you to stay into alpha and theta states, and those are the states of huge achievements, specifically alpha. Being in alpha is being in the zone. Being in alpha is being that person that, like sport athletes know about this, you just shoot the ball and it always goes in. That's being in alpha. Or you just, literally you're in the zone and you can say whatever you want during that day and it's always right. That's being in alpha. Well, they've shown that the adjustment will change the brainwaves. You adjust the person, you will take them from beta, which is stress, and transform instantly into alpha. Now, when you talk to people who do literally PhDs on bio and neural feedback, they say if you can see that, you radically change the person. That's how each adjustment works. They can't see that. They literally don't see that. For them to see a change in a beta wave where it's high, and then an alpha wave, and literally cross where the alpha goes up high and the beta goes low, they go, this is unbelievable. And they literally retested it multiple times, because to change the brainwaves that instantaneously changes the person, changes their personality, changes who they are. And that's what the adjustment is we're changing neural function at the state of the frequency, which means that at the state of who you are.
At that moment?
Instantaneously. So literally, we've had functional EEGs and shown it instantaneously after the adjustment, within a millisecond, the brainwaves change. So you take the person right out of stress, and that's why there's a lot of anecdotal stories by doctors that say, I adjust somebody, and they went out of extreme paranoia attack mode and relaxed. And we can see why, because we instantly take them into alpha. So our goal as chiropractors is to find out where the stimulus is needed, what side of the brain we need to stimulate, and by causing it to recalibrate, that's where the healing comes in. And that's why, depending on how the person's adapted, the spine is actually a communication system that the brain is using. Because it's literally telling me, I need more stimulus, say, on my left brain, stimulate right here. And when we adjust them, it'll help them be better. Yes, James?
How does drinking alcohol affect this alpha and theta?
How would drinking alcohol affect the brain function?
The brain function, yes.
What it'll do is, based on where you are, you'll start bringing out deep-seated emotional issues. So what it'll do is, first off, the alcohol is a chemical substance that will cause subluxations. Because when you drink it, it will stimulate your pancreas, it'll stimulate your liver, it'll also inhibit the neural communication. Now, a lot of people that live in high beta function, which is high stress function, when they drink it, it suppresses them so they can relax. So anybody who has ADHD, specifically, alcohol is an easy thing for them to get addicted to, because it suppresses them enough so they feel okay. The suppression will inhibit them from getting better. What that means simplistically is this is why people can become addicted to alcohol, is because they become addicted to the relaxed state, so they have to consume the alcohol to calm down and relax. That relaxation is what they become addicted to, but the chemical substance, just like a drug, is what's being used. Now, if you take the body and you adjust them, you can do that naturally. And that's what everybody's body is able to do. The other thing that you will see in people who are alcoholics is they will have pancreas and liver issues, which means they will have mid-back problems that will bug them a lot. And those mid-back problems are because the chemical induced a subluxation. Taking in the alcohol induced the body to adapt to try to help itself out. But it couldn't because it overstimulated one side and will actually cause a rotation of a segment. So the segmental rotation is just an indication of a brain dysfunction. Now, you can also, with the alcohol, get into, it is a dopamine deficiency issue with most people. And alcoholism usually runs in tangent with people who have learning disabilities and addictive personalities. And you can say addictive personality, but it's actually a dopamine deficiency issue. And what it is the alcohol will actually stimulate a dopamine release. And that dopamine release is what people get addicted to. So in families that are alcoholics, usually either attention deficit or dyslexia or different learning disabilities are very common. And they're common because those are a subsect of that dopamine deficiency problem that doesn't allow it to adapt correctly. There's a whole protocol on this, and we actually do it in my office. It was actually used to get people off of heavy substances such as cocaine and heroin and meth and things like that, because it's all a dopamine deficiency issue. But alcohol, obesity, food, gambling, sex, all these different things are all different ways to get your dopamine payoff. It's just each person gets it differently, and they decide which one's going to be okay with them. So to change that dopamine and that reward system will determine how your body will adapt. Now the thing is with alcohol itself, because it is such a big depressant, and we know that because if you drink too much you fall asleep or you pass out or your body just stops working correctly, it's a very chemically active substance, so it's very easy for people to become addicted to it, because if they're in that high state, they want to get suppressed very easily. And what we do with those people is that we naturally stimulate the dopamine receptors, or I believe it's the A1 allele cell. If I might be wrong on that one, but I can get back to you on that one. But we do that through light and sound therapy as well as auriculotherapy. And what that will do is upregulate the dopamine naturally, so it can be pulled in easier, and then that need to drink will actually go away. Because you don't crave that dopamine anymore, you don't need the payoff, which is from the alcohol. So alcoholism is a disease. It's a lack of dopamine. It's the same as obesity. If you're addicted to the food to get the payoff, could be considered a dysfunction. But in our society, it's what is considered okay and what's not considered okay. So the alcohol will give you the payoff of the dopamine, but if you don't get that body to upregulate it correctly, you have to keep taking more and more and more, because your body will downregulate the payoff centers. And that's why people have higher and higher tolerances, is because they have to get more alcohol to feel happy, or get stoned, as people would say. So to get back to that, that's a form of a subluxation, is that inability to adapt is a chemical imbalance, which is your body's inability to express health. So the bigger concept here is an adjustment is to change you back into homeostasis or allostasis, whereas a manipulation is to physically alter the body to maybe help with pain. And this is why you'll hear other professions such as osteopaths or physical therapists say they manipulate. And I'll agree, they do manipulate, because they're not looking for the same changes that I look for. I'm looking for a purely neurological based change. And that neurological based change is going to change the whole structure of how the body functions. That's why I can say things like this. I had a lady come in today, she's been getting adjusted for 3 weeks, and she came in and she's had extreme anxiety since her fiance, she broke up with her fiance. And within 3 weeks she came in and she says she doesn't grind her teeth anymore, and that's her body being able to relax. She doesn't have anxiety about talking about her fiance anymore, and she really is emotionally okay. So this is why there's conflict between the two professions, because they say, well, how can you manipulate somebody and change them? And I go, you can't. Manipulation is never going to change a neurological function. But if you adjust them to cause a change in the brain stimuli and how it will adapt to the body, specifically causing hypervagal function, or the theory is called the polyvagal theory, that's the goal, is to stimulate the vagus nerve. And that happens majority, 80-90% of the time, in the neck. So if you're somebody that will not let anybody adjust your neck, you will never get the results that you want to see. The neck and the sacrum are where the pure relaxation or parasympathetic relaxation comes from. So the adjustment is to put the body into a parasympathetic or relaxed tone. That's ultimately what I'm looking for. And that parasympathetic tone is where the emotional, chemical, physical bodies change. And this is why a chiropractor can say, if I adjust you, I can see you get pregnant if it's somebody who's never been able to get pregnant. Because what we're doing is we're stimulating the parasympathetic tone so that the body will relax and then allow the uterus to conceive. Whereas if you're in a fight or flight tone, your body will say, I'm not going to do that. Why would I reproduce? We're being chased by lions and tigers and bears all night. We can't heal. We can't have enough energy to run away and reproduce. We're not going to reproduce. This is why there's such a high incidence of infertility in America, specifically in North America, because we're stuck in that high beta or sympathetic tone and our body won't heal. This is why we can go through multiple levels of healing, emotionally, physically, chemically, and the answer is yes. When you put the body into parasympathetic tone through vagal reactions or upper cervical adjustments, that's when miracles happen. So the adjustment is to change the neurological function. It's not to move a bone. Yes, Randall?
When you have athletes that learn specific refined movements, speaking of, people that skate, people that dive, that learn these refined movements, how much of that is in their neural pathways
All
and in
neural
the brain?
pathways. It's completely neurological based. Everything that you are learned has been a learned trait is a neurological based trait.
How do adjustments affect people with those kinds of?
What it will do is it'll allow the firing process to upregulate. You'll work quicker. So common thing I hear from my athletes that I take care of is, well, I get stronger. Okay, that's because you'll actually activate the muscles in the right order.
Get the muscle memory to
So the muscle memory that you're talking
reactivate.
about is the neurology, is the neural firing. So what you do, and you can see this with power lifters, is they train their body to have their neurology fire and have every single, say, chest muscle, like the pec major and minor, to contract at once. When I was in undergrad, I saw a little guy, he was 150 pounds, I saw him bench press 600 pounds. And it was because of all of neurology. And you know this because we know these inhibitors, we train them to stop happening. When, say, a mom sees her baby under a car, she can lift up a car because the inhibition is turned off and you fire every muscle. Now, they don't tell you that the next day you can barely move. But if you neurologically train yourself to turn on, that's what happens. So it's about adaptation and causing the specificity of how the body will fire. That's what we do. So when you're talking about muscle memory, that's purely neurological. So when you talk about somebody, I say, well, if you come see me, I know you'll get stronger. They go, well, how do you know that? I go, because we're activating the muscles so they'll fire correctly. We're activating so the agonists and antagonists, so the muscles that work in each way, will fire better. And if you work on it specifically and train it, what you'll do is you'll train that muscle to fire at 100% instead of 30 to 40%. And that's what it usually fires at, is 30 to 40% of all the muscle fibers, and not all of them. And that's why when you work out, a lot of people work out for long periods of time. Now, I'm going to throw something in there to show you how this works. So there was a test done to see if thinking about exercise and exercise was the same thing. And they found out it was. So they literally took somebody, and they took these men, and they went to the gym, and all they were supposed to do was bicep curls. So they went to the gym, and they did bicep curls for half an hour, I believe. And they did another group, and all they did was sit in a chair and think about doing bicep curls. And they both had the same growth in their muscles. So it's all a neurological function. The firing of the neurology is what causes the body to grow the specific region.
Okay, what is one of the reasons, like skiers, they grow up skiing fast and everything, and suddenly they're afraid of heights?
Afraid of heights? That's gonna be, I can only give you an educated guess. I can't give you 100%. Usually that would come from an accident or a fall where you ingrain the trauma to skiing, and then you have an emotional connection to it, and that emotional connection would stop them. That's the only thing I could correlate it to, but if I talk to somebody like that, I could usually figure out within 5 to 10 minutes what it was. But that's why in our office here, we'll do a thing called injury recall technique. And what it is most people aren't aware that neural loop is associated with a specific muscle. So if they associate pain with doing a squat, which is skiing, then their body will cause them to have a specific anxiety or fear associated with doing the squats, and then they'll associate it with a visual reaction, aka being up high, and then it's a feedback loop, and then it feeds itself. Being up high means squats, which means pain, so up high is indicating of pain. That's one thing that we'll see, and I see that a lot with people. So if we have something where it's like that, what we'll do is we'll figure out through muscle testing, which is a way to see how the neurology will fire, where the problem is. We'll figure out what muscle has what emotion attached to it, with which will cause deactivation, test it, break that loop through an adjustment or a specific proprioceptive or feeling input, and then the body will function correctly. Does that make sense?
Yeah.
So basically we break the loop. If the loop's causing pain and fear, we break that loop. And that's what the adjustment will do, because it will instantly take you out of, and most people aren't aware of this, beta or high energy is the only place you can feel pain. If you take the person out of beta and put them into alpha, they cannot feel pain. That's why there's people who can meditate and they can bring their brains down into the alpha or theta states, and you can literally light a candle over their hand and they will not feel pain, because it's impossible to feel pain if you're in that different brain function.
So how do you know when you're right, left?
Brain function,
When the muscle's pulling the spine?
you can actually feel the segment move. That's what I feel when I palpate people's spines, and that's why we went to school for long, is to get very good at spinal palpation. So you can actually feel the tone of the muscles, the edema. You can also feel the segment and how it's rotated.
And that's what you just want.
And that's why, I'll move up and down your spine and figure out where it is. And that's an easy way. The body's actually telling me, if you adjust this and stimulate this part, it'll pull itself back. So it's the stimulus going in, and that's why I can use a little clicker, or I can use a light touch. But the key is here, is how ingrained is that neurology, or how ingrained is that loop of problem determines maybe how much force I need to apply. Because if it's really well ingrained and has an emotional attachment to it, we may have to put a lot or a little in, depending on the person. Because each person adapts differently, and that's why it's called practice, because I have to literally figure out how you will adapt and what the best way to adjust you is. Does that make sense? Okay. Do you guys have any other questions?
So physical therapists usually for back, they use the,
A back brace?
yeah.
Yeah. So what they're doing there is they're putting in a proprioceptive input to the whole area to try to stimulate the brain and make it work right. Here's the problem with doing physical therapy. Unless you change the alignment, you will work in the body to have a misalignment. You will train it to be neurologically incompetent. And then it takes longer for me to break the loop, because the longer you've done it, the harder it is for me to break the loop. And that's why with a lot of people, I'll see them go to physical therapy, and then the muscles will eventually weaken again because it's not really changed. The brain will take over, and the problem will come back. So it's a neurological change. There is no such thing as muscle memory. What it's actually is called nerve muscle memory. Because a simple way for you to look at this is, have you guys ever seen somebody with what's called waiter's tip? Where they walk around like this? It used to happen a lot in the 60s and 50s when the doctors would pull babies out by their arms and they would rip the nerve that controlled all the extensors. And so all those muscles died because the nerve controls it. And because they died, the body got stuck like this. So the nerve, because it wouldn't contract, because it wouldn't control the muscles anymore, couldn't heal. So they're literally walking around like this. Because the nerve's dead, the muscles will never heal. Another way for you to understand how the nerve works is if you ever had a stinger in football. So when you get hit hard enough and the part of your arm goes numb, that's the nerve not working anymore. And then you can't move it very well, that's a stinger. That's how important the nerve is. The nerve literally runs everything in the body.
So when the doctor delivery, because I saw how they deliver, push down the head, push up, then until the shoulders show up, then you grab the shoulder.
Yeah, and then pull it out, yeah.
Yeah.
The maneuver, that's why I love taking care of babies, because that maneuver by itself will cause compression on the brainstem. And what will happen is the body will adapt based on how the neurology is being pressed on. And that's why in our office, if you're under care and you're a parent, we take care of the child at no cost for the first year because I want them to develop correctly neurologically. So when you're talking about that maneuver to pass the shoulder, just by that alone can cause brain pressure.
Yeah.
So I've seen that. I had a child that I took care of in Michigan when I used to practice there, and the child came in and it was cyanotic. It was completely blue, and it had what was considered a normal birth.
Yeah.
And they'd seen all the local medical doctors, the pediatrician, the neurologist, and orthopedist, and they all came back with the same diagnosis, which was esophageal reflux, which is heartburn. And I go, well, that doesn't make any sense. You tell me the kid is blue because it has heartburn, and it was literally blue. And so what I did is I adjusted that child, and it took 6 adjustments in an hour and a half, and what was out was the first bone, the atlas bone was out of its neck, and coincidentally, that's the center of the brain, the brainstem, that controls heart rate and respiration. So it was blue because it didn't have any ability to communicate. We adjusted, each time I adjusted, it kept getting pinker and pinker and pinker, and by the last time I adjusted it, it completely turned back on, had a little cry, suckled on mom, it was fine.
So how come the OB doctors are still doing the same thing?
Doing the same procedure?
Yeah, they pull, just turn, and then,
The reason why is because of just like how I said manipulation and adjustment are different, is that we've been taught that the body is a physical thing and does not have intelligence. Because you can literally, there's a movie called The Business of Being Born, and you can look into this, and you can deal with people. And the reason why we have such a big birth issue in our country is because the pelvic wall on most women is weak. Because they don't have a strong enough pelvic wall to force the child out easily. If you go over to third world countries where the women are working, they will have children in literally under an hour and be back working again.
don't they wish that?
And it's because we're not strong enough as a society. We've been taught that we're supposed to sit and our body literally gets weak. So the difference is that we have a whole society of people that do not have strong pelvic walls. And so if you have a woman who's, say, a runner or has a good pelvic wall and takes care of it, she can have a very quick birth. Very, very quick. So the maneuver is...
You're talking about the delivery, not the
Yes.
labor.
Yes, the delivery. Well, I've had patients who've had 45-minute deliveries. The whole labor and they literally go into labor and it's 45 minutes. I had one lady, she pushed 6 times and it was her first baby, so she was happy. So it's really correlated to the body and the emotions attached to it, as well as are you trained? Because the thing that blows me away is you're basically taking a woman and you're saying to her, you're gonna run in a 1 mile at the Olympics, but before you do that, I don't want you to move for 3 weeks. So it's literally counterintuitive. You're gonna go into a race and you gotta be in the best physical shape you can be in, but don't move and do anything before. Don't do any training. And that's what we're doing in our country. And that's why we're seeing all these invasive things. Like right now in California and in New York, the C-section rate is 66%. Now, the World Health Organization states if the C-section rate goes above 10 to 15, we are putting the woman and child at risk. So where's the disconnect there? It's because literally the diagnosis that I've been taught from my nursing friends is they're called too posh to push, the mamas are. And so it really comes down to, if you're gonna deliver, you should be in shape. You should take care of yourself. I met one lady, and I only tell you this because it's possible. She's a chiropractor, she had 3 babies. Each child, she lost 5 pounds. She lost 15 pounds after having
As
3
opposed to
kids.
putting on 40.
Exactly. So it's all based on what you want to do and how you're going to do things. Because we've been taught that being pregnant is a disease, and it has nothing to do with being a disease. Being pregnant is a normal fact of life and how you go through life and do things. You do not have to be a victim. It is not a disease process. If you take care of yourself and keep taking care of yourself properly, it can be a very empowering thing. And that's why there's another thing, another video I'd really suggest looking into. It's called Orgasmic Birth. And it shows that, you know, the woman can actually have an orgasm during birth instead of pain.
Is it a one-sided thing or?
And so,
For God's sake.
if we look at it, we can see that it literally is possible to have that happen. And that's why I talk about these things, is because these are things that most people don't know. That if your body is working correctly, you do not need drugs. You do not need surgery, you do not need interventions. Your body will work correctly. And there's quite a few documentaries and talks on this that really indicate that your mindset of what it's gonna be like really determines how your birth is gonna be. And most people have been taught that birth is gonna be scary and it needs drastic interventions and all these things. And the truth is, it doesn't need to be. If you look at our countries, in the US, there's maybe less than 2% are home births. In Germany, which is a very forward-thinking country, very smart, 95% of all births are home births. They're all related to having a midwife. So if you have somebody from Europe and they come over here, they'll go, well, who's your midwife? And they go, what are you talking about? We have it at a hospital. They go, that's crazy. Why would you do that? It's not a disease. And that's why it's a little different when you talk to people from different countries. Excellent, so we're done. What I want to say though is I know everybody wants to make a change in somebody's life for the bigger. Everybody wants to be something big for somebody else. We don't do what we do because we want to just make money. We do what we do because we want to help people. At least that's what most people like. Would you agree with me on that? Mm-hmm. That most people do something because they want to help somebody else? So what I ask is, if you have a friend or family member who doesn't know simple things like your body doesn't need to be in pain, you don't have to be on drugs, you don't have to have surgery, your body can heal itself if it's taken care of early enough, let them know that they can contact me. They can, I'll literally call them if they want, they can come in for one of our talks. But the big thing I'm showing here is that I want them to be empowered to know that they can do things like a woman know that she can give birth. And it's not a disease. These are very simple things, but we've been taught that these are big interventions that need to happen. So just think about a friend or family member, and if they come to mind, have no problem calling me and just letting them know that there are other ways to take care of themselves.